everyone, but I think everyone's name's up now.
Yes.
So we're good with that. Okay,
Right.
never mind.
And you're live.
Okay, thank you. Thanks, Rob. Okay, you can go ahead, Counselor Harris.
Wonderful. Hi, everyone. Thank you so much for attending. We will call the meeting to order, and my job is super easy. I will pass it over to Chief Mainprize and Chief Greenwood.
Who wanted to introduce the presentation?
Okay, hi, it's, sorry, I had it on mute and I was trying to get it off mute. Are you okay with that, Chief? I'll just start with everything.
Yeah, absolutely. Yeah, thank you, Chief Greenwood. I was trying to hit my mute button at the same time. I was obviously it's Chief Greenwood's presentation, and certainly it's appropriate to allow her to introduce it for the committee.
Okay, great. Well, I must say, everybody, thank you very much for joining us on a beautiful, sunny afternoon. We are very, very excited about the progress we have been making with Mass LVP, and Alex is here and will be speaking shortly in regards to the work that everybody has done over the last few months. And I will say that a lot of the work occurred just as we were entering the pandemic response in our respective organizations. So in the wake of things that have currently been happening in Barrie, and as we have seen around the world, on how we need to re-examine how we carry on our roles as municipalities, as police, this work seems to be significant, even more significant than we first realized. So we need to address the systemic roots of criminal behavior and disorder. We need to encourage reform over sentencing that doesn't just focus on the Barrie police, but our community as a whole. And what have we been hearing, and what is encouraging is that our community is ready and waiting and welcoming some of the discussions we have been happening. So our community recognizes the needs of a different course of action that we traditionally have done. And now we're looking at a multidisciplinary, holistic approach to community safety and well-being. And as we've said in the past, not one of us in our separate pillar or our separate organization can do this alone. And we have seen how collaborative efforts have worked, such as our situational tables with Collaborate Barrie and other work that is going on. So this consultative process has been very successful thus far. And I really don't want to take away from what Alex is going to present today, but I'll give you a very broad overview of some of the steps that we've taken so far. So we've completed a draft report, which is the work of multi-groups, multi-efforts from our working groups to our focus groups. And the working group has met on several different occasions and have come up with and continue to have conversations, whether it be focused one-on-ones. And our consultant has been able to bring all of the work that we've done to this part all together. So Alex is going to take us through what we've done thus far. And I will advise that this presentation has gone to the Barrie Police Services Board just because of the work that we have done overall in regards to community safety and well-being. So I'm going to pass it on to Alex, but before I do it, Alex Way is working with Mass LVP, and that firm has, it's an Ontario firm, which is always nice when we're a Canadian approach to things, and they've been focusing on public engagement, supporting collaborative work on policy development. So Alex has led multiple projects in a variety of policy areas, including criminal justice, social services, urban planning, and public transportation. So Alex, could you please take over the screen with the report, which is in kind of a PowerPoint presentation report style? That would be great.
Yeah.
Thank you.
Thank you, Chief.
Very much looking forward to sharing this update with all of you. I'm going to put up some slides on the screen so everyone can follow along. I believe you'll have received a copy of this presentation just maybe an hour or two ago. I'm going to speak for, let's make sure this tech is working, and then I'll give you a sense of what we're going to do next. All right, can you folks give me a thumbs up if they can see this blue report? Yes, working well, thank you. All right, so I'm going to talk for maybe 30 minutes to run you through these slides, provide an update on how the working group has been helping to develop this community safety and well-being plan, give you a sense of next steps. I'm really hoping that we can get into a substantive conversation about the content here, especially in terms of how to refine some of the draft actions that have been developed by the working group that are really at the heart of the plan. So that's the hope, and I'll answer questions hopefully once I get through the content, but really hoping that this can be a kind of generative conversation amongst all the participants here as we work forward with what we've accomplished so far. I'm not going to belabor the background. I know you're all well aware of some of the legislative requirements around the community services and community safety and well-being plan, identifying risk factors, identifying priorities within those risk factors, identifying actions, and setting out measurable outcomes that the actions are intended to produce. In terms of kind of understanding what a community safety well-being plan is meant to be, I think one of the core things to understand, which I'm sure, again, you're all well aware of, is that this is really about accelerating collaboration. It's about finding ways with limited resources to put together some actions that can be achieved together. And this means that, while the plan itself as a document is important, it needs to be part of an ongoing process. So, this is all about community safety and well-being planning rather than simply creating a community safety and well-being plan. And this is one step along the way. In terms of steps we've taken so far, right? So this working group, to refresh your memories, established with direction from the committee by the Barrie Police Service to help develop the first community safety and well-being plan for Barrie. The working group met 3 times in early 2020. We held also 3 community stakeholder roundtables about some of the emerging areas of interest. One was around homelessness and housing, one was around community resilience, another was around mental health, addictions, and criminal justice issues. Those are used to gather additional perspectives. And then draft actions were developed by the working group at a final meeting on March 12th, which was really just as much of this COVID pandemic came about and came to impact many of the organizations that we're working with. So work was put on pause after that final meeting during the early months of the pandemic, but we've been reconnecting and picking up momentum again now that we're beyond that first phase of the COVID pandemic response. And the work now is really picking up on those draft actions that were created at the March 12th meeting, refining them through one-on-one conversations with working group members, and helping to flesh out the plan around these key components. You will see a list of members that participated actively. Hard to list everybody who's shared a perspective so far, but these are some of the core members who have been involved up until this point. So what I'm going to do now is walk you through some of the steps that the working group took to give you a sense of the process that they moved through to arrive at these draft actions, and some of the pieces that we'll be relying on and building from when we're writing out the actual draft plan to present back to the committee. So first off, one of the first things we did was to work with the group to identify what the aspirations for a healthy and safe Barrie were, what it really meant to try to create a safer and healthier Barrie for all. And you'll see these 16 aspirations listed at the bottom that the group identified. But in terms of a highlight, ultimately the working group members believe that the plan should seek to build a foundation of strong, inclusive community bonds, improved working relationships amongst service providers, improved supports for the most marginalized, and ultimately this all results hopefully in a more safe and thriving city that can be enjoyed by all. So that this is the kind of guiding light that we're working towards. Everything else should help inform how this plan can get us there. The next step was to identify risk factors. So this involved, yes, the advice of the working group, but also those stakeholder meetings, those roundtables, and some additional desk research. 21 risk factors were identified that lead to poor community safety and less well-being in Barrie. These 21 are listed here in alphabetical order, but what we did next was to organize them into 5 focus areas. One around mental health and substance use, where you can see 4 of those focus areas listed. Second, around housing, homelessness, and basic needs, where there were 5 of those risk factors listed. Crime and justice issues, you've got 3 risk factors listed there. Service gaps, 5 risk factors, and then this bucket around community resilience and community bonds. So we've got 4 risk factors there. So having grouped these risk factors together, the next step for the group was to dive in and better understand each of these risk factors through qualitative and quantitative evidence that we gathered from the group members, from stakeholder roundtables, statistical sources, other secondary sources. I'm not going to go into a lot of detail. I'm presenting this next few slides really as a couple of highlights here and there, but to give you all the opportunity, if you'd like to dive in and see if there's anything that jumps out as new or different or helpful in terms of framing some of the issues and what's going on in Barrie today. And so when we looked at mental health and substance use, we explored questions around direct and vicarious trauma and how that's affecting people's well-being, addictions and opioid use, mental illness, youth vaping was a concern that rose. But in terms of a really highlight across a lot of the conversations and the research, there were real concern about the harms of opioids. Obviously, with Barrie as an unfortunate outlier in terms of having some significantly higher rates of both opioids overdose emergency department visits and Ontario and double Ontario's rate of opioid overdose-related deaths as of 2018, without much evidence that those trends have changed significantly since then. But a number of other issues related to mental health and substance use that were also discussed and explored, as you can see here. When it came to housing, homelessness, and basic needs, we explored the questions related to poverty, to precarious employment and low wages, affordable housing as something that drove a lack of safety and a lack of well-being in the community. Homelessness, obviously, and food insecurity were all explored. But the broad headline again now was that poverty and the rising cost of housing really is putting certain Barrie residents at greater risk of harm, with rising poverty rates slowly but steadily over the course of the last decade, as well as rising housing costs due to the proximity and geography of the city in terms of its growth trajectory. When it came to crime, we explored questions around human trafficking, gang activity, organized crime, also family violence, serious, significant issues, and as well as vulnerability to online threats. There was a lot of discussion about scams, taking advantage of individuals who are less able to protect themselves online, and other sorts of online threats that are fast evolving. And I guess in terms of a headline here, while these issues around family violence and human trafficking, gang activity, and organized crime are really serious ones that deserve attention, there was a sense that online threats, especially for youth and seniors, were increasingly dangerous, and that it may not be given the attention that it currently maybe deserves. And so there was an interest among a lot of the individuals who are participating in highlighting this as a particularly explored issue that's affecting the safety and well-being of individuals in Barrie. Service gaps, a lot of information here. Not surprisingly, a lack of resources was a key concern, and that this challenge of a lack of municipal and provincial resources when it comes to providing services to those who really need them is a real struggle. And service providers are working on ways to have greater impact with limited resources, obviously, but gaps certainly still remain, and that was important to be highlighted. So there's a number of different dimensions and risk factors to that are listed below here. Finally, this question around community resilience. There was conversation around caregiver and service provider burnout for those who are caring for individuals who had complicated needs. Weak community bonds came up as part of the conversation, and a sense that people wanted to build a stronger community, social isolation as a concern, and also questions around discrimination against various groups in Barrie as something that people raised concerns about. But broadly, there was this theme that came through consistently that as Barrie grows, residents do really want to foster greater connection with each other and strengthen Barrie's social fabric. So those were the risk factors that were explored. In terms of the next steps, the working group then had an opportunity to explore existing programs to make sure that whatever the community safety and well-being plan brought to the table, it complemented and built off of existing services and initiatives that are already really making an important contribution to safety and well-being in Barrie. So there's a number of examples down here that were identified by working group members saying, we've got this covered, now how do we build, how do we work around, how do we support, how do we amplify some of these existing services. We also talked about new initiatives, new ideas, new inspirations from elsewhere, things like the Justice Center, things like overdose prevention services, youth advisory councils. The various ideas were shared by the working group and heard from some of the other stakeholders that were then explored moving forward. But given limited resources and time for this plan, the plan couldn't address every risk factor that had been identified and every issue that had been explored in the presentation I've presented above. So instead, several draft actions were developed that shared three characteristics. One was responded to risk factors of particular concern, right? Things that were really rising to the top of the pile in terms of things that needed to be addressed today. Complementing existing services and supports that are already working well, and then are really, importantly, feasible to achieve through a collaborative effort, given limited resources that are already available. So back in March, the working group developed these 12 actions. They don't address every risk factor, but they are meant to make a really substantial, strong step forward within the limited resources that are currently available. So in March, you see these 12 actions. I'm not going to go into detail at this point with these 12 because I have a refreshed and updated version as of conversations today. But you'll see 3 actions under the mental health and substance use bucket, 2 under service gaps, 2 under affordable housing, 2 under crime, and 3 under community resilience. So then, after the kind of pause that this work took because of the pandemic, the work has now focused on refining these draft actions through one-on-one conversations with working group members as well as other key stakeholders. So what we're really trying to do at the moment is identify a lead organization for each of the actions, who will take responsibility for coordinating and advancing the work. Second is to identify the key partners who would work with that lead organization to implement the action. And then third is to refine each action, its rationale, the kind of supporting steps required over the next few years to achieve that action and to identify the anticipated outcomes. So this work is ongoing, and what I'm presenting to you now is kind of a midstream snapshot of some of the refinements and developments that have occurred, which I think is great timing because it means that we can have a really useful conversation about where they stand and where further attention is required. So as of today, here's where the 13 draft actions currently stand. I'm going to walk you through them group by group, but you'll notice down at the bottom that white space in the previous slide is being filled with a new bucket, a new action related to pandemic preparedness. Given the challenges that have emerged and the lessons learned from COVID-19 and obvious threats to community safety and well-being that pandemics, so we've quickly learned, present, it's hard to not include reference to working on pandemic preparedness. And this is an evolving question of what exactly this might entail as part of the community safety and well-being plan, but we think it's important to include some action related to that in here and complement with other city of Barrie and county plans that are being put forward. So I'm going to walk you through them one by one in each of the categories, provide a little bit of detail around each of them, a little bit of editorial, and then hopefully we'll be able to have a discussion about the content presented here. All right, so when it comes to draft actions and potential supporting steps related to mental health and substance abuse, the first action that was developed was to work together to increase investments in harm reduction and treatment, including overdose prevention services. Given the challenges related to opioid use and harm created by opioid, it was a key consideration for folks that was put forward. And this might include things like expanding and enhancing naloxone training, developing an updated service model for an overdose prevention site in Barrie that would save lives and expand access to treatment and recovery, and identify and work to address the most pressing treatment gaps for those undertaking dangerous drug use. So it'd obviously be done in close coordination with the Simcoe-Muskoka District Health Unit and their opioid strategy. There would need to be alignment with that, but felt it was important to reference this as a key action to support better, more safe and well Barrie. The second draft action here is to work together to see that training and support on trauma-informed practices is offered to a wider range of community and public service providers. I think there was, broad recognition in the conversations that people's experience of trauma, if not supported, people aren't supported to manage and treat and help deal with those traumatic experiences, have a risk of having ripple effects, and people can harm themselves and harm others because of the traumatic experiences they've had. And that by helping to equip a broader range of public service and community service providers with an understanding of trauma-informed practices and trauma-informed care, then we could better respond to the challenging behaviors that sometimes arise because of those traumas that people have experienced. So the idea here would be to consult with community and public service providers who may not have received this kind of training, but are increasingly expected to work with vulnerable populations, right? Folks working in parks, folks working in libraries, et cetera. Establish training that would respond to their needs, supports interactions with these populations in a safe and compassionate manner, and help them to de-escalate situations more effectively. And third, to consider whether, in some situations, training may not necessarily be enough, but that embedded mental health workers in high priority locations or facilities could be an effective use of resources. So to at least explore that question of going beyond support and training. The third recommendation or draft action under mental health and substance use is working together to expand the use of intensive, flexible, community-based care teams that serve residents facing serious and intersecting challenges. So the example of this in Barrie is the ACTS team, the Assertive Community Treatment Team. The two sides to this recommendation, to this action, are one, really to support the existing Mental Health Act team in Barrie so that it can really effectively take on as many appropriate cases as possible. And then second, to examine ways in which such a team model can be expanded to other priority groups of at-risk individuals who maybe aren't appropriately served by the existing ACT team, but would benefit from this sort of intensive community-based care for folks with really challenging intersecting issues going on in their lives. So those were the three recommendations, the three draft actions that are currently being refined and presented by the working group as they relate to mental health and substance abuse. When it came to service gaps, there were two draft actions developed. The first was to launch an annual event which would strengthen relationships among service providers and community leaders working to improve community safety and well-being in Barrie. So this annual event, the idea would be, to bring together everyone who touches this issue from a community leader or service provider or government level, and to talk about some of the challenges that are arising and to discuss progress towards successful implementation of this community safety and well-being plan as a key kind of gathering point, whether online or in person, to touch base and say, how are we doing? What topics does everybody need to know about? What initiatives does everybody need to know about? What more can we do to make sure that we successfully get in 4 years' time to the successful completion of all the actions in our plan? The fifth draft action that's being developed relates to collaborative tables, situation tables like Collaborate Barrie. So expanding the use and membership of tables like Collaborate Barrie to better facilitate how service providers work together to respond to situations where a particular individual who maybe have relationship with a number of different service providers is at risk of significant harm. Another two different parts to this. Step one is to simply provide a kind of refresh to the membership and practices of the situation table to make sure we can sustain and even increase its effectiveness when it's responding to situations which are defined as acutely elevated risk. So there's a kind of clear and high level of risk that is required to be met in order to take a case or a situation to the situation table. The second piece of the puzzle there is to explore ways to create similar models that work a little bit further upstream. So people who may be on their way towards a situation of acutely elevated risk, but aren't quite meeting the criteria yet. Is there an opportunity to create another table or a subgroup that could address situations like those more effectively than are currently being addressed today by various service providers working in a potentially uncoordinated fashion. So those are the two draft actions related to service gaps so far. The two actions related to housing, homelessness, and basic needs, both of these really do focus in on housing, homelessness, affordable housing issues. The first is to establish a maybe quarterly City of Barrie roundtable on affordable housing solutions. That's ultimately aimed at kind of building alignment, shared commitment, and a strong united voice across sectors and communities in Barrie. And the idea here is that, there are a lot of conversations ongoing about the challenges around affordable housing and homelessness. And there's a real difficulty in moving some of the big solutions required forward. But some of these conversations are happening in silos, and the opportunity to gather people with different perspectives and voices to at least make sure that we're maintaining strong alignment across sectors and communities about, what's working and what Barrie needs could be an important and helpful facilitating step. Ultimately, the idea would be, yes, to share updates and identify shared priorities and support relevant initiatives, but ultimately also strengthen a kind of united voice and united calls for increased funding around innovative housing models and working towards a renewed City of Barrie affordable housing strategy in, I believe, 2025 is when the next 10-year strategy is going to be developed. So that's a kind of big picture conversation-based work. The second recommendation around housing focuses on trying to expand the impact of low-cost initiatives that improve access to housing for the vulnerable, such as Rent Smart program, which is a kind of tenant education program, and the Housing First Landlord Forum. Both of these are examples of initiatives that are really meant to kind of improve dialogue between tenants and landlords in order to create more successful tenancies for vulnerable individuals, but also then to identify on a regular basis either to launch or to expand the impact of kind of these sort of low-cost initiatives that ultimately might improve access to housing for vulnerable and very. So 2 levels of work around housing and homelessness articulated there. Around crime, 2 actions that are being drafted at the moment. One, developing a proposal and building community support for a community justice center in Barrie. So ultimately, the focus of community justice centers here is to really try to deal with issues at the intersection of criminal justice and social services that are maybe contributing to a sort of revolving door where the criminal justice system, though they're using the tools they have at their disposal, are seeing people coming back where the underlying issues are not being addressed, and whether this is a way by gathering and changing the way courts work that you might be able to more effectively respond at the moment when someone's coming into contact with the criminal justice system through coordination and collaboration in a given location. So, some steps here, obviously working with a range of partners to look at models domestically, internationally, to identify relevant inspiration, to identify challenges at the intersection of criminal justice and social services that the Barrie Justice Center could seek to address, identifying the resources that are already available and could be brought together to create a community justice center, and then as well as building an understanding of the potential additional resources that would be required in order to move forward with the vision, and ultimately developing a proposal and building support amongst a real diverse cross-section of Barrie that this could be something that could really help the well-being of and increase safety in Barrie. The 9th action relates to online threats. So it's about working together to help at-risk residents learn how to better protect themselves from scams and other internet and phone threats, identifying, what needs to be mitigated, what's most at risk, what populations need support, looking at existing resources, and developing strategies for helping vulnerable residents access existing resources that can help them protect themselves online. In terms of community resilience, 3 draft actions. The first is to work together to renew and expand the ranks of Barrie's volunteers, in particular after the COVID-19 crisis, where the ranks of volunteers, in many organizations have been depleted. Could we create 1,500 and fill 1,500 new volunteer positions across community organizations in Barrie as a way to promote community participation and strengthen community resiliency? And this would be sort of a 1% goal, that 1,500 newly filled volunteer positions would represent approximately 1% of Barrie's population actively volunteering. A coalition of organizations and individuals could work together to achieve this, building off some of the neighborhood self-help and community self-help groups and efforts that have grown out of the COVID-19 crisis, potentially involving Georgian College and students there, and helping to address and connect people to appropriate volunteer opportunities, various ideas around what the strategies might entail on that draft action. Number 11, working together to accelerate the development of places and facilities that strengthen community bonds. So, recognizing that space, even today when we're living in a virtual world, at some point, space is a really important way to build those bonds and build greater understanding and connection to each other. And that ultimately makes for a more safe and thriving city So this is about connecting organizations that have a passion and a commitment to places and facilities that do strengthen communities, and helping them work together with the city and with the county to support existing community spaces, make sure they're working really well, but also see that new spaces and places are being developed, like the proposed multicultural center. And then number 12 is around the question of kind of community inclusion. And the idea here is to launch a collaborative multi-year campaign for inclusion that encourages really all Barrie residents to play a positive role, making Barrie a safe and welcoming place for all. You know, there was some recognition that there were some, you know, potentially simmering kind of tensions in the community as the city grows and changes, and that those may be longstanding or emerging, but that part of creating safety is creating a climate where everyone feels welcome and that everyone can play a role in doing that. So you can imagine a collaborative table of organizations who are committed to this type of work, choosing an annual theme and various activities and strategies and a series of communication messages and events that would help to highlight a key theme or concern and a way that Barrie residents can help make their city as inclusive as possible. So those are the 12 actions that were developed by the working group and then refined through further conversation over the last several weeks. And finally, just you know, there's a placeholder here regarding pandemic preparedness. Obviously, we'd need to be working closely with the Simcoe-Muskoka District Health Unit on this to identify key pandemic preparedness gaps based on what we've learned from the COVID crisis, and then developing measures to address them. So that's the overview of the 13 actions as they currently stand. In terms of next steps, we're continuing to seek implementation advice from working group members. I've been able to connect with a number of them, but others are still being scheduled in for these one-on-one conversations, given, you know, evolving vacation schedules and the real challenges that many service providers are currently facing given the COVID-19 situation. Also seeking implementation advice from yourselves, from other key partners and community members more broadly. So this might entail another online survey over the course of the summer, or some online focus groups with key populations to test out some of these ideas and make sure they resonate and feel sufficiently substantive to address some of the concerns that they're experiencing. We're preparing a final draft of the plan itself, so moving from this sort of slide deck presentation to a more formal plan document that centers the actions that are being developed. Handing off that plan to the committee in hopefully in Q4 2020, and then over to you to finalize, make any adjustments you'd like, present to council hopefully for approval, and get this thing published so that partners can begin to implement these actions over the next few years. So that's it for my my presentation. I'll since everybody has this document sent to them, I can turn off my screen sharing. That's option one. Option two is I can leave it up so that folks can see these 13 actions in front of them. But I'm really interested in you know, following the conversation where it goes, but interested in your reactions, your questions, your sense of what needs to be changed, adjusted, improved, how we can modify this so that it really does achieve as much as possible for the city of Barrie going forward. So thanks, everyone. Should I hand this back to Chief Greenwood?
Alex, thank you very much, Alex, for that. I just saw Natalie was unmuting, and as the chair, I thought she may speak. But the work that has been done by the working group has been phenomenal. I think it may help just to have the screen up in regards to the draft actions. But as committee members, I'd just like to remind you, and Alex said it very eloquently, all the progress and the action items and everything, but please keep in mind that this is not the plan, this is the report. and that we need to have some feedback from everybody on the committee. And I realize not everybody is participating today just because it's challenging for people with a COVID response. We have some challenges over the summer holiday. But Alex, just so you are aware, committee members have had the opportunity to review this because they have received it. One of the other things that I'd like to remind the committee members is that we did approve phase 2 of the community safety and well-being planning stages. So we will continue, this is kind of the phase 1 piece. In phase 2, we'll continue to do some work from an advisory committee perspective. Once again, we'll introduce an online survey to identify people in the community in regards to some feedback in that perspective. And then we will start with the one-on-one or small focus groups with residents and other individuals in our community that are interested in participating in this approach. And I would like to see with our active community members that are looking for reform in our community, I think this is a great piece that will help in modernizing and progressing our city as we need to respond from a cultural, inclusive, addressing the root cause of some of the crime and disorder that we are experiencing in our community. And I think with that phase 2, and we do have the financial support to work through phase 2, that by the end of this year, Q4, we should be able to have a draft report that the committee will all approve, and then that will go to and Wendy, maybe you could help me with this one. I believe it's the finance and the committee that has to approve it before it actually goes to council. So I think we made some significant steps, but I would be very much interested, as would Alex, like to hear feedback from the different groups and how are we our next steps. So maybe, I guess the first piece does anybody have any questions from what the working group was able to accomplish? And then we'll look at our next steps. And it looks like Natalie.
Thank you. I forgot that I already unmuted myself and I'm calling Millie. So I've learned that I need to step up my Zoom game because I'm on an iPad and had no idea that you could see me taking selfies with Pepsi that I could send to Chief Mayor. So that's great. And because I'm the chair, Wendy, if I have the draft actions on the screen, I can't see anyone else. So maybe you could watch and see who has questions from that. I can't see it.
If anybody has questions, if they could raise their hand, like on the Zoom.
Like with the button.
With the button, yes. And
okay,
then
yeah.
I hopefully can see. I'm going to have to somehow get.
And so, yeah, sorry for that early entertainment of me taking selfies with Pepsi.
Alex, if you could just turn off your screen for a minute, then I can, because I can't see all the members. It's like, okay, perfect.
Everyone should have received the document. I'm happy to turn it back on and off, but if you have it in your email, you're welcome to take a look as a reference.
Okay, I don't have, does anybody have any questions right now? Okay, go ahead, Councillor Harris.
Okay, thank you. I didn't know if maybe I would wait till last because I was the chair, but this is kind of a go with the flow. So I guess I just wanted to add a couple comments on a few points that I thought were really great. So I love that you added the draft action for trauma-informed practices to increase throughout the community. So I'm sure that Chief Mainprice and Chief Greenwood could also comment too, but that's so important that we're seeing that increase in the world of first responders themselves. And then now being able to expand that into public services and those other providers, I honestly had never even thought of that before. And that's so important, because if we're dealing with people, root cause is often that are struggling in the community, root cause is often linked to trauma. And how will we provide the best care for them if we aren't trauma informed? So that is so awesome. I love how that was pointed out. So, I wanted to mention, if it hadn't been mentioned before, that so you said annual report, annual event to strengthen leadership. Maybe this has been brought up before, but last summer we did have a baseball game, and it was with the first responders, and they were on one team, and then community members, a lot of people who were actually battling with addiction and in recovery were on the other team. Mia, you were there. Chief Main Prize is there. There were a lot of great people. So maybe to implement that every year as well was really awesome. I thought it was wonderful to have that interaction with the community. I loved that we are using the new volunteers that have come forward with COVID-19 groups right now in Barrie. So 1,500 new volunteer positions. I think a lot of people, now that they possibly have volunteered for the first time in their lives because of COVID-19, would really love the opportunity to continue that when some of those groups have kind of, dwindled a little bit, which will hopefully happen, which is a good thing. And just love that you'd have the campaign for inclusion to, do a multi-year thing in the city of Barrie. I think that's also quite relevant to what's going on right now in our community. So I'm just so impressed. I think it's a great draft, and thank you so much for everyone's effort with this. Thanks, Wendy.
Yeah, I'm just a conduit here. There's lots of people to thank, who have been really helping to inform it. So happy to be presenting their work and that it's resonating with you, councillors. So really appreciate that. So one of the key questions that, if I can maybe put one to the group that, we're working to figure out is, these actions are wonderful in themselves as ideas, but we need to have organizations stepping forward to take them on and lead with partners. And there's obviously a role for the city of Barrie itself as a lead around some of these activities, and then also for other organizations to step forward and say, we'll take the lead with the support of the city and other partners on some of these activities. So helping to point as a committee to where you see, these are ones that we should definitely be talking and confirming with X or Y organization. That would help me in my follow-up work if there's natural alignment that you can see. Also, the kind of natural alignment that you see for the city of Barrie itself to take a leadership role in any of these actions. That would be helpful direction. A lot of what we'll ultimately do in terms of the next draft is trying to layer on not just the ideas, but who exactly would be doing them, and articulating the rationale and the steps, not in the abstract, but with the people who are specifically committing and stepping up to play a role. So interested to get your direction and advice about where the city plays a role and where particular organizations you think we need to connect with as part of the next phase. That's one key question. The other is obviously just like, I think there's a lot of great content here. Is there anything really that's missing that we should add, or are there too many things to put up in the air all at once? And are there things that maybe need to be taken off to ensure that we can successfully achieve everything? There have been people who've been working closely with all of these items, so they're close to people's hearts, but that doesn't mean that, for folks to take a step back and say, maybe it's strategic for us to combine, reduce, or increase the number of actions. Does this feel right in terms of the size and ambition of the plan? So one question around size and ambition, one question around implementation advice and key partners. Both would be really helpful at this point.
Great. I know we have two questions. Kind coming up, but people asking questions. But I guess to address what you just asked, Alex, Wendy and Chief Greenwood, I know that we collaborated together and we made a list of all of those agencies and organizations that Alex is kind of referring to, who would be doing what. What is the next step? Would that be part of the next phase that we would be figuring out who is doing what?
I'm also happy to answer that question if that's helpful, Chief Greenwood or Wendy.
Oh, you have the answer. That's good. Sure.
At least that's the hope at the moment, right? The hope at the moment is that the next phase really moves from, today, I'm already starting to try to identify those organizations who would take a lead role and what those steps would look like under each of these actions. So the organization itself that would maybe, or the player who would be leading, as well as partners who would support them. So moving from these as ideas to really detailed next steps. And that work would then inform the plan. So we're really we've been starting on some of that work, but we'll continue it over the course of the summer.
So did you want us to answer the question or just ponder the next question about whether or not there were things that you wanted us to kind of maybe minimalize or expand on? Did you want actual answers right now, or did you want that to be in a format after we look at it more?
I welcome your reactions at the moment. I'd also welcome further follow-up conversations if anybody feels that taking time to ponder would be valuable. So I'm happy to take emails. I'm happy to take phone calls. But I think in terms of where we're at, those are where the sort of considerations we're trying to lock in around these 12 actions, these 13 actions now, and make sure that we're working towards being able to implement them effectively.
Great. So I guess we'll maybe expand the conversation a little bit, and I'll go to Greg Ferguson, who does have a question and some comments.
Yeah, great.
Thanks, Natalie. Can everybody hear me? First of all, Alex, to your team and to the working committee, I think this is an excellent draft document. It's well thought out. It's methodical. It's detailed. I think your team's done a great job, and the working committee has worked hard. So just a comment, but I do have one question. We've obviously identified 13 draft actions. At what point in this process do we go back to the measurement or the ability to measure those actions? Because in my experience, we go through an action plan and we ended up dropping some and adding some because you can't measure them. And obviously in the slide on page 2, the last bullet is to set out measurable outcomes. And I know it's a bit of a chase your tail, at what point do you do that? But I'd be curious at what point, in your opinion, would we start to apply measurable tools to that? Thank you.
Yeah, great question. Just making sure I'm not on mute here. Yeah, so yes, I'd say that comes after, it's in the next little while. Once we have lead organizations identified, partners identified, and some steps confirmed, then I think it's fairly easy to say, okay, what are some measurable outcomes that we have control over in terms of being able to achieve those? And if the conversation around measurable outcomes creates new questions that need to be then brought back to refine the language around the actions, figure out who needs to be involved. Hopefully we can do a little bit of that cycle that you're describing, but around each of the actions rather than looking at the plan as a whole. So you can imagine that the report itself, or the plan itself, will have some introduction, but then 12 sections where it outlines the action, the steps, the partners, the lead organization, and the outcomes that are meant to be achieved that are hopefully measurable in some way, shape, or form. We'll advance that work as much as possible over the summer, and then bring that plan back to you as a committee, and you can let us know whether those outcomes seem to be the right kind of level of measurement. You can put a lot of time into trying to figuring out the details of this, but whether they give enough of a sense whether we're making progress against these items.
Awesome. Okay, thank you, Greg. The next person we have is Councillor Harvey with a question.
Yes, unmute Councillor Harvey. It looks like, there we go.
Can you guys hear me now?
Yeah.
First of all, I'd just like to say I'm extremely pleased to see where the working group has gotten in such a short period of time compared to where we were just a few months ago at one of our last committee meetings. The only question I have is, especially since we've seen some significant changes in our community, especially with how vocal it's become in and around, specifically around policing. When I look at the list of people that are part of the working group, I don't see anybody that would specifically identify as a group from our diverse community other than the Barrie Native Friendship Center. So I was just wondering if there's any consideration of kind of expanding, especially from the diversity side of things, into the committee to make sure that we don't miss that as we're coming closer and closer to creating our final draft plan here.
Thank you, Councillor Harvey. Alex, did you want to answer that?
Sure. I would welcome the opportunity to connect with any and all community members, organizations that haven't yet been involved or need to be followed up with, in particular around concerns, reflecting anti-Black racism or any others. And the plan over the next few months is to expand from the core working group out as the actions become clearer to ensure that we've got everybody on board and that everybody's giving the thumbs up as much as possible. So I'll happy to take advice around the particular individuals or particular organizations that we should put on our list as high priority stakeholders to speak with.
Sure. Chief
Great,
Greenwood?
thank you. I'll have a further discussion offline with Councillor Harris, and then either one of the two of us will reach out to you. And obviously, it would be great to get the chief's input on this also.
Wonderful.
Chief Greenwood?
Thank you very much, Councillor Harris and Councillor Harvey. One of the committee groups that has just recently been established is the Anti-Racism Committee that both the mayor and I are chairing. So that would certainly be a group that would be included in the process. I know that we've identified the Barrie Indian Association. We've already spoken about the Barrie Native Friendship Center. We'll be connecting with the Simcoe Muskoka Family Connections. They're doing some great work in regards to inclusivity, equity. So I think we've got some really interested, engaged people within our community that are looking to share this information and participate. So what I believe our next steps should be from a committee perspective, I know we've already approved stage 2 for the plan and the process. What I would like to see is that the report be received by the committee. So I'd like to put a motion on the table that the report be received by the committee, that each member of the committee review the report and identify out of the action or the initiative that they would like to probably co-lead or take a leadership role on, and then that would assist Mass LVP and Staff Sergeant Gates and myself in regards to what the next steps would be, and then identify, is there someone, Wendy, from the city that would be assigned to this, not on a full-time basis, but a more robust basis, so we can identify who from the city needs to connect with Alex from that leadership piece that was identified in a couple of key action items in in the report. So I guess I've spoken about many things. From the next steps, we're proceeding with stage 2, the one-on-one and the focus groups, that the committee receive the report. That's the motion put forward. And then committee members identify which areas that they're most interested in to support the group work that is being done by the consultants.
Wendy, did you want to comment on that?
The motion is fine. I just wanted to, through you, Councillor Harris, to Chief Greenwood, I just want to identify Corey, Chief Main Prize is the staff lead for the City of Barrie.
Great. So I guess we'll have the motion on the floor then to receive the draft. Wendy, you can see everyone maybe. Can you see everyone? I can't see everyone. Okay, so I guess we can, who would like to second that? We need a seconder, Wendy?
I can second that.
No, you don't need a seconder, but that's okay.
Okay, so who is in favor of receiving?
That's Jim. Right?
Can you just raise your hand if you're in favor of receiving?
Do you want a physical or a vote on the chat?
I can see, if everyone raises their hand, I certainly can see it because everyone's on the same screen. Councillor Harvey, oops, I'm just going to mute Councillor Harvey. Councillor Harvey, are you in favor of the motion?
Yes, I'm in favor.
Thank you. I just can't see your hand, that's all. Okay, it carries. Thank you.
Great, thank you so much. So that carries, and I guess going forward, we will look over the draft that we just carried and looking to see where we could help to co-lead and really focus our own backgrounds to helping move this further. Go ahead, Wendy.
Oh, I just have a question. Did you need a committee meeting scheduled in September, Chief Greenwood?
I think that would be helpful because I don't want us to lose momentum. And I'm wondering in the message to the community, if not the community, sorry, in a message to the committee members, if we give them 3 weeks to review and identify which areas that they wish to be their area that they want to focus in on. So if we look at, today is the 6th, so if we looked at the week of the 27th to get input from the committee members, does that sound reasonable, Wendy, from your perspective?
Sure.
Just
Through you, Councillor Harris, to Chief Main Prize, does that seem reasonable to you as well? From the staff being the staff resource?
Yeah, it gets a manageable deadline. Now we are bumping into some summer vacation times, which might bring a few people out of the loop. Certainly over the next 3 or 4 weeks. But you know, I'm sure we could get it done. I'm open to the suggestions from the other members of the committee because we're going to receive it. They're going to be the ones that have to do the most of the work. So I would defer to the members of the committee who are going to be making the comments with respect to the draft actions.
Whatever, I mean, Wendy, it works for me. If everyone else, if you want to ask everyone, that's fine. I wish I could see all of you.
Councillor Harris, John Clark's raised his hand.
Okay, go ahead, please.
I think it's a fair request that we have seen this. I certainly know I've done my meeting with Alex already. I think others probably have as well. So a sense of what's in the report, we've had a chance to look at it. We should have had a chance at recognizing people are coming and going in terms of vacation, but I think a 3-week piece is more than reasonable considering we've had it for a bit. We can book our times with him. So I think it's reasonable. That's my comment. My question that remains for me is we haven't decided on which ones will go forward and which ones we've potentially dropped. So I'm curious to know how we will finalize that as this committee. Will it, my suggestion is that as we go through and highlight what we can lead, they would rise to the top, and perhaps those that don't generate interest, perhaps either we find somebody or they don't make it. So that's my question.
Yeah. That, to me, thank you for that. That sounds like a great idea. Wendy, what do you think?
I would probably defer the question to Alex or Chief Greenwood.
I'm so used to asking you everything, Wendy.
It's okay.
Every poor thing. So we will defer that, yes, to Alex.
It just from the position of working with Alex and the working group and the focus groups, I think it's important that we still work through all of these, because if you remember, this is a multi-year plan. So we're not going to accomplish everything in the first year. I think that we continue to gather the information. We still need to see what is a priority for members of the committee, and I think that will be very telling, as we have discussed already. But I think in the fall, we need to prioritize to say, this is the overall plan. This is what we hope to accomplish in year 1. This is what we hope to accomplish in year 2, and this will be year 3. They will be very much interconnected, but I think that we're in a position that we'll be able to do that in the fall. So when we do present the work to the next level committee, and then it eventually goes to council, I think we will have a roadmap, a framework that it illustrate what our timelines are and what we hope to accomplish. But that will be part of, the next phase in our report. Alex, did you have anything you wanted to add?
Not at all. I think the idea that if we can find energy behind each of these items, they can move forward. It's feasible broadly, unless other folks suggest otherwise. And we can return to the question of sequencing in the fall.
Great. Thanks, Alex. Chief Main Prize.
Yeah, thank you, Councillor Harris. I couldn't find the raise hand button on my screen, so I just had to do it with my hand. Would it be important to maybe consider including the metrics for everyone to review prior to making their comments? I think that everyone can have a look at what's here, and they can make some comment to it, but not understanding how it's going to be accurately measured might be a challenge to provide really fulsome comments. So I'm just curious. I know we've talked about what the metrics are going to be. If there was some ability to include those sooner rather than later, it might be helpful to get to improve the level of comments from the committee members.
That's a great point. Thanks, Chief Main Prize. Alex, is that possible?
It's a little bit of a chicken and egg here, unfortunately, I think. Hard to identify the metrics without working with the partners to clarify the steps and the measurement systems that might be in place. So I think what I put forward is what I'm able to confidently get guidance from you on, and if and when some solid metrics emerge that can be shared, they will be shared to receive input on an as needed basis in advance of the next meeting, if at all possible. I'd love to be able to provide an update on metrics over the summer. I just don't have that yet.
Great, thank you, Alex. Yes, go ahead. I forget.
John, it's okay.
I think
Okay.
John has a question.
John.
Yeah, it's okay. It's just a comment on metrics. I just want to echo what Alex said. I think, and I apologize. I know we all deal with metrics all the time, so careful. I'm not moving into lecturing. I think our metrics is we've been able to get 13 or 12 of 13 passed, or 12 of 13 agreed upon, or our leads on. I think that's our early metrics. I think this, to Alex's point, the second piece of metrics becomes, so the trauma piece is something that I'm interested in from a frontline perspective. Once we sit down as a trauma group and decide what we're going to roll out here over the next 4 years, we can build in some more tangible and concrete measures going forward. Thanks,
John. That's great. Anyone else have comments on that question from Chief Main Prize? Okay, I guess going forward, we would need to schedule the next meeting, Wendy?
Yes, Councillor Harris, I can reach out to the committee members and find an appropriate date in September, as well as, do you want me to send the communications, or Corey or myself to send the communications about the July 27th deadline, and who would those comments be going to? So I can provide an email address, if that's the way we're going.
Yes. I mean, I'll offer myself to gather everything and then send it to Alex if that helps everyone, or maybe it's more appropriate that Chief Main Price or Chief Greenwood does, whatever.
Yeah. Well, go ahead, Corey, sorry.
Yeah, I'd certainly, from the staff support standpoint, we're happy to act as the liaison to collect all the information and distribute it out to everybody. I provide the email address for my admin assistant who can help collect all the information.
Thanks, Chief Main Price. That is wonderful. That works for me if it works for everyone else.
And unless you'd rather receive it all, Councillor Harrison.
No. Not broke. We don't need to mix it. Perfect. That's great. And Wendy, do we have anything else that we need to discuss?
No, this was the only agenda item today.
Well, thank you everybody for your patience with my lack of Zoom knowledge. And I thought that it was a really great presentation. Really excited moving forward. And I guess we'll just have, do we need a motion to adjourn, Wendy?
You can just adjourn the meeting as the chair.
All right. So thank you for everybody. Thank you everybody. Enjoy your beautiful day outside, and meeting is adjourned.
Thanks everyone.
Thanks, everyone.
Bye.
Everyone.